welcome to another Wednesday, the day after the 4th of July. This is the Health, Wellness, and Lifestyle Program with Dr. Donna Christensen and Linda Dorman here on our TV.network, which is broadcast on Roku and Amazon Fire Stick and our Android partner. And also broadcast from the Virgin Islands on WSTX Radio. So welcome everybody who's listening and who is viewing us right now. Hi, Dr. Christensen.
Hi, good afternoon. How are you? How was your weekend?
It was wonderful. I had a great weekend and I feel blessed. We made it through the storm here in the Washington, the DMV, and other places on the East Coast, but to have a beautiful 4th of July to celebrate.
It wasn't all that it was predicted to be, which was really good. Yeah, because we had my oldest granddaughter had her birthday on the 4th and we were able to celebrate.
Oh, well, that's a blessing. And, she's living in a time, day and age where the assault on women's health is still so stinging. I keep thinking about a generation like that. How old is your granddaughter?
Well, that one is 22.
She's 22. Okay, but so she's a young woman.
Yes.
And I know that, healthcare, we're going to talk a little bit about what that means to young women, middle-aged women, all women in particular, when we talk about the Affordable Care Act. And you are such an amazing guest, not guest, but co-host, given your intimate involvement with the shaping of the Patient First Act, as well as the Affordable Care Act. And, we're going to talk about that, but I also want to make sure that
it was very interesting, though. I think it was a highlight of my time in Washington.
Wow, that says a whole lot working under the Obama administration and with that team to really put something as formidable and as extensive as the Affordable Care Act together. Finally, we could get some. I know it's a lot of controversy, a lot of pros and a lot of cons, but at the end of the day, is it working for individuals? And I want to say that it is.
Absolutely. And when the pandemic hit and people started losing their jobs, the thousands of people who were able to benefit from the exchange and from Medicaid expansion where it existed, the numbers grew tremendously. So it was a real safety net for those who otherwise would have lost insurance because they were no longer employed.
Or lost the ability to afford very expensive insurance plans. And this was a time that we really needed it. But I also want to say, because our TV.network has really grown as a broadcast platform under the leadership of Anthony Weeks, the visionary. And so I want to make sure that one of our early partners that I do acknowledge them, because we have a good lineup, is Tempo TV. So it's great. So I appreciate that. So,
Tempo is a TV station that I'm very familiar with and close to. As a matter of fact, the owner and the president of Tempo was one of my patients when he was a little boy.
Oh, and he's a former colleague when we were both at Black Entertainment Television. I'm not sure if our paths ever really crossed as well, but certainly know of him. But, I'm glad that he is a partner along with all the other ones that we are so blessed to have the platform broadcast on for all the programming that Anthony and team has put together. And this is one of many segments. And this happens to be the one that I love because I love health. And I love the fact that we're twinning in our background.
How about that?
With our books.
And the colors as well, pretty much.
Yes, I love it. We're in sync. That's good. Well, let's bring in our great guest so we can have
I'm looking forward to this conversation.
Yes, so we have Benita Graham, who is a retired, I aspired there, with Freddie Mac. She is the former, works for the former multifamily division, Harasana Shomi, who's an RN, and she is with the Feel Better Health Center, her own center. So we're going to talk a little bit about what that means. And then Anita Graham, who is principal and partner with Artis Impact Investors. And did I say that correctly, Anita? Did I pronounce that correctly?
It's Arteris, but we'll take Arteris.
Arteris, wonderful. Well, welcome to the Health, Wellness, and Lifestyle Program with Linda Dorman and Dr. Donna Christensen.
Welcome.
Can you hear us?
Yes,
Thank you.
indeed.
Yes.
Okay,
Thank
perfect,
you.
perfect, wonderful. This is live TV, so we got to make sure everybody can hear you. That's the most important thing. And ladies, thank you for joining us today. We're going to get right into it because our time is limited. We have about an hour, and we just want to make sure we get all the conversation going. And one of the things that we're going to center in on is the Affordable Care Act. Where are we today? How is it impacted in the things that you have done, you personally and professionally, and what you're also seeing among your sphere of influence and network, because this is a formidable time in our country where healthcare is still about to be on the, with the Roe versus Wade. It just makes my hair stand up and wonder what else is coming that we will have rollbacks on, or we will have our constitutional rights to just primary care impacted. And so, let's start the conversation, however, with Dr. Donna Christensen, who has had a right at the table seat in shaping the Affordable Care Act when she was member of Congress. And we're so blessed to have that perspective.
Well, I'd like to at least begin hearing how it has impacted the work that our guests are doing. I had the great honor of being on Energy and Commerce and on the Health Subcommittee during that time. And we did a great job in the House. I wish what we passed in the House really had become the law. But after it left the House, we had a lot of work to do to regain some of the provisions that were almost lost. So we're really happy with what we ended up with, but we always looked at it as just a first step and not the complete passage of what we know is needed in this country. But it was a great first step, and millions of people have benefited from it, but we still have work to do.
That's excellent. And there is a lot of work to do. And there are two parts to the Affordable Care Act as we know it: the patient protection, and then there's the Affordable Care Act part. So those are
the patient protection and Affordable Care Act is what the House passed. But after it went to conference with the Senate, and the Affordable Care Act is what the final product was.
Great. And then what's the Healthcare Education Reconciliation Act that was also amended? So, we encourage our listeners and viewers to really get to know the details of these acts, because you're living under it here in the U.S. and in our territory. So,
that special thing in the Senate where you have to go through reconciliation was required to get some of our provisions through.
Wow. Yeah. So when we think of investors and we think of trying to fund our own healthcare, Anita, let's start with you, because I know you work with a lot of individuals and a lot of businesses as well, looking at their financials, looking at how they're going to become solvent, how they're going to be successful. And healthcare is a big ticket item on, budgets out there. What are some of the things that you're seeing as an impact to investors and to those that you speak to in the financial services industry?
Well, thank you for that question. And Arcturus Impact Investors, we are that. We are a social impact investment firm who does two things. We look for deals that are obviously going to provide the financial return that we're looking for, but we also focus in on particular areas, and that is businesses that impact underserved communities, companies that provide livable wages and health benefits for their employees. We actually look at that, monitor that, and measure ourselves and our companies by that. That's our impact side of what we do. So those two items must coexist for us to invest in a business. And so when it comes to healthcare, as you can imagine, and we're looking to make sure that our companies are providing what we call health benefits to their employees, having affordable healthcare is critical. It is a big number on a lot of these small businesses, and small businesses, as we define them, and we look at them, are companies that may have revenues as low as 5 million, but typically on average, our companies are somewhere between 25 and over $50 million in revenue. So, but they're hiring, 200, 300 employees. In one case, one of our companies has over 1,000 employees, all of whom are able to participate in some level of health benefits. We think that's important from retention and recruitment of individuals. It is a growing number on the financial statements of most of these businesses. They're always looking for ways to get the best, to get the best cost benefit for their employees, but they understand that a healthy workforce is critical to the sustainability of their business. And if you don't have a healthy workforce, then you have turnover. You have all the things that start to then impact the operations of their business. And so the really forward-looking CEOs, and we're fortunate enough to believe we back several of them, really see health benefits as a critical component for their workforce growth and workforce development.
That's outstanding, because I know a lot of employers, this tips them over. It says, well, do we salvage and do we make profit? And then how much profit, so that we can continue, moving forward in our business and, buying more supplies, doing training and development, doing research and development? Or do we put money on the budget line item to fund these premiums that are growing? Because we do want a healthy workforce. We can address that from a whole nother standpoint, the rising cost of premiums that they're experiencing because of the
out-of-pocket costs of all sorts, sending people into bankruptcy, people losing their homes, having their wages garnished, all kinds of things happening because of the out-of-pocket costs that are difficult for many families to meet.
Yeah, it's an interesting cycle that, we have a healthcare system, a food chain supply issue. We have very expensive pharmaceuticals. We have the impact that we can't even begin to understand, the staggering impact of something as called the pandemic, that's long standing, particularly for those long haulers. And maybe we all are long haulers, and we really don't realize that until later on, when things start to pop up, that our healthcare system is our biggest safety net yet in terms of our future, in terms of that 22-year-old granddaughter of yours. So when we think about Roe versus Wade as an example of, spending time, energy, and effort to roll back a 50-year constitutional right for women, it's just, in families, it's daunting, to say the least. And so we have also with us Feel Better Health Center. Tell us a little bit about that, Urshana.
It's a brick and mortar business we started, and it's kind of geared towards focusing on women and children health and primary care. We're focusing on preventive care. How do we get them in the door before they they have complications, or their health deteriorates to different levels where they can't manage, and you see them in the hospital. So that's what we're kind of focusing on. We understand that women do a lot of sacrifice, and they get their children in the door and take care of their children, but they don't always do so for themselves. So combining that care under one roof is kind of where we stand. And so by profession, I'm a pediatric nurse practitioner, and I have a partner whose family, and she focuses on the women's health. But I've been, in women and children health for a very long time as a labor and delivery nurse, as a mother baby nurse, before being a pediatric nurse practitioner. So I understand fully, the challenges that healthcare is seeing right now, and even from my own personal experience, leaving the hospital and trying to work in the community as a primary care provider, just the staggering difference between the cost of healthcare as a hospital registered nurse and coming out and being a nurse practitioner and having to deal with some of those the costs that you guys are talking about.
Is your center a federally qualified, or is it's a private center?
It's a private center.
So that means that there's no subsidies from the government to provide services to underserved communities. They have to self-fund through their insurance plans or out of pocket.
That is correct. That is correct. They have Medicaid, which is in Maryland very good with in terms of providing healthcare for children. But when it comes to the adults, not so great. If a woman is pregnant, then they do get automatic coverage, but after that, things just kind of get a little bit more complicated.
That has to bring a great deal of stress for women, and you certainly don't want a woman to be inside of and outside of her pregnancy. This should be a blessed time
Right.
to give birth to a healthy baby and not one that has been impacted through stress and teaching.
There is some movement, and I'm not sure where it stands right now, to make sure that Medicaid is extended at least a year after the delivery, because even when you look at things like the maternal mortality, that mortality doesn't always take place, or the complications don't always take place right after the delivery. It can happen anywhere up to a year after.
That's just amazing. Yes, because then you have the childcare. So I'm sure you see a lot in your practice. What are you had mentioned some of the challenges. Can you give us a few examples that, as you listen to women who are coming in and children? So this is about affordable healthcare. Yes, we're talking about the mainstay of the family, which we know often in the community are women and the decision makers around healthcare for families and communities. But we also are mindful that healthcare extends to everyone. So in your practice, what are some of those challenges that you do see?
So we're quite a new practice, but in general, I do see. I've gone into the community and I hear what those say when I'm talking to like daycare providers or daycare centers, and they say a lot of, when it comes down to the children, there are a lot of gaps in care where you have children who need there's special needs children who need developmental intervention, and they're not getting it because they're not able to see their provider. Or maybe they might not even be able to, they see their provider, but they may not be able to get the services that they need from the state or from the local government. So we're seeing a lot of that, and I did like a community assessment just to kind of see what are the problems out there when before we start, so that we can provide those services. Just getting the children to the right resources will do a whole lot to mitigate what could happen or potentially happen in terms of falling behind in their grades and not being ready for kindergarten. So those are some of the things that I've seen, and even going to the adolescents, having access to healthcare. I went to one of the high schools, I won't mention names, but in the area, and they said a lot of times the vaccinations are not up to date because they don't have adequate health care. And so we're finding that how do we bring the access to the people, how do we improve access, and how do we make it affordable. A lot of immigrants, they come in and they don't know how to navigate the system, or they may not have the proper permissions to do so. And they feel like, well, I'm just gonna, stay to myself and stay away from the services, and that potentially causes its own harms, especially when it comes to the children. And we were talking about women, and you mentioned it before, Linda, and Donna, you have that, they don't seek prenatal care, and that just kind of has a cascading effect as to everything down the line, how things complicate the health of the woman and the unborn child, and just looking into the system and how far it would go.
Do you know of any school-based healthcare clinics? Because one of the provisions of the Affordable Care Act was to provide more in-school clinics.
Oh, wow.
So that is popular actually in Howard County. It's something that, but we're located in PG County. I'm still looking into, some of the details of what is available to, in terms of having the access in the schools. But I'm sure they do have them, and that's something that a lot of counties are pushing for, having that clinic in the school. So you're right there providing health care for the students, and that also reduces them missing school. You take care of them, and sometimes the parents can't get off work to take the kids to school, and so it kind of it impacts the whole family, not just the child.
Right.
And that's such an interesting point, and love to get Benita your take on that, because you've worked in multifamily, and so it reminds me of the conversation or the question that we all had when the Honorable Ben Carson took over as Secretary of HUD, Housing and Urban Development, and you're thinking, well, why wouldn't he go to Health and Human Services? And one of the things that he said, which I thought was I could receive that very positively, was that having grown up in an environment within the community where housing and the lack thereof, or the instability and the lack of community resources in that housing, in those areas, really was the beginning, as you mentioned, of a healthcare crisis in that family or in that community. And that's why he wanted to take over that agency, to be able to put an umbrella over it and begin kind of the long journey towards improved healthcare through stable housing. Were there in your time, and I know you're retired, Benita, I'm jealous of that, but that's okay.
Housing is an important determinant for health, so I can.
Yes, it is.
But go ahead, Benita. Sorry.
Yeah, no problem. So yeah, absolutely. That is the mission, of Freddie Mac, is to provide affordable housing, and multifamily was the mechanism that we did that through. But one of the things about the Affordable Care Act that was so great was that it allowed parents to keep their kids on their plans, much longer than in the past. But to be honest with you, kind of what I'm experiencing now, since I've recently retired, was actually sticker shock on my healthcare premiums. Because once you reach retirement age, you have to do Medicare Part A. It's required. And with most healthcare plans, you also have to do the Part B, because Part A is really just your hospitalization. Part B is your maintenance, your doctor visits and such, everything except for prescriptions. And based on your income, the minimum payment used to be $144 a month for Part B. It recently increased to $170, but based on your income, you get this modified kind of adjustment, gross income adjustment, that they take from your tax filings 2 years prior to your, say, for example, your retirement. At that point, you're at your peak income, right? You're at your peak income level. And not only do they just take your income, if you file jointly, they take the combined income. So what happened was my husband and I found that we were paying over $1,000 a month for the Part B. So I didn't know just kind of how the affordable plan helps in that area at all. We have since gotten it resolved when we asked them to kind of use our tax year now that we're retired versus 2 years ago, obviously. But that's still being resolved. And it's like I said, sticker shock.
Well, let's pick that conversation up, Dr. Christensen, if you can, and Benita, because I want to understand that a little bit more about that sticker shock, because maybe I won't be so jealous after all, right?
Exactly.
In just a few seconds, a quick commercial break. Give all of our programs a chance to promote themselves and to see what the great work that's doing on Our TV. So thank you for being with us, our guests, and we'll come back after the commercial. This is OurTV.network, the Health, Wellness, and Lifestyle Program with Dr. Donna Christensen and Linda Dorman. We'll be right back.
So nice, so nice. So nice, so nice. Virgin Islands nice. So nice.
Time. It has a different meaning in the U.S. Virgin Islands. It goes backwards, forwards. It stats. St. Croix is rooted in history. So much of it still remains untouched.
I remember running on these streets as a kid. This shop was right down there. It opened the same year I was born. This is where the original Cruzan hook was born. It's the symbol of these islands. And I wanted to have my hands in that very same history. I want to be able to pass it down to my family while still putting a new spin on it.
The U.S. Virgin Islands, we have an amazing culture that developed over time from all over the world.
St. John feels so untouched. Being underwater is like another world. There's no worries, there's no stress. I can just escape. This is my happy place. My passion for scuba diving came at just being fascinated with the water and wanting to be a mermaid. And this is the closest thing I can get to achieving mermaid status. Canadians just love being outdoorsy. We live for adventure, so we love anything hiking, being on the water, diving, snorkeling, and St. John has it all.
It's like some spirit is protecting the island and keeping them raw. The Makujumbi watches over the island. From up there, they keep the evil spirits away. The nightlife in St. Thomas is absolutely amazing. There's always something going on. Everyone comes together to dance and catch a vibe. We're always celebrating. We celebrate freedom, culture, the food, the smell, the music. It's always a celebration. The people here are probably the most priceless thing because they keep the culture going. There's so many different influences on these islands. Food from all kind of countries coming together in new dishes. All of us came from somewhere, but all that we call this home. The VI is a new melting pot. This is where the past and the future comes together.
Well, welcome back to the Health, Wellness, and Lifestyle with Wendy Gorman and Dr. Donna Christensen and our wonderful guests. And we were just leaving off with the conversation around something that we're all going to look forward to, but it's scary, and that is affording health care in retirement and what the Affordable Care Act makes provisions to support or not. And Dr. Christensen, you were about to say something.
Yeah, the Affordable Care Act did really not impact Medicare. It was really geared to making sure that individuals who were unable to be insured because of cost would be able to be insured, either by the provision of subsidies for the premiums and guaranteeing a set of benefits, or by Medicaid expansion. So I'm really surprised to hear that your premiums for you and your husband got as close to $1,000.
that almost seems unreasonable.
Yes, yes. And one of my boards is the Consumers for Quality Care. We've done surveys recently, but the premiums are one of the biggest complaints that we hear from the people that we surveyed. The rising premium costs, the deductibles, which are also increasing, and which keep people from, as Hassana said, seeking care. Even people who are insured are reluctant to seek care because they feel they can't meet that out-of-pocket cost. But so Benita, how did you
So
how did you reduce the
first of all,
cost? By adjusting it to your retirement salaries, you said?
absolutely. So it took us about 3 months to even get a hold of someone to talk to at the Care Administration. But there was a form we put out to request that they not use our joint returns from 2 years ago, which I mentioned you're at your peak salary level there.
Right.
With these additional premiums are based on. We filed the form for them to use our current income, which you wouldn't file to 2022 tax returns. And so they did make the adjustment, and, brought it down substantially. But in the meantime, like I said, that took about 6 months to resolve.
Wow.
So in the meantime, we were paying those premiums, which, that was a bite.
Yeah, we have to someone needs to figure out how the easier way to make those adjustments, because that was quite a cost for an extended period of time. But the Affordable Care Act did not impact Medicare at all. The last thing we worked on in the House on Medicare was the prescription drug plan. And to the extent that the Affordable Care Act provided $250 or so to every person who was in Medicare Part D to offset some of the cost of their out-of-pocket for medication. I think that's about all that we did with regard to Medicare.
And my question then becomes, and maybe Anita, you might know a little bit about how this works, but I know you're working with businesses versus individuals in investment, but just thinking through how to lower our taxes, how to somehow create offsets that will allow us to better afford to reduce that cost if it's based on our initial salary coming out of retirement, or just having to pay for it as working individuals, using the healthcare programs like the deferred payments, where you can put money into a health savings account of some sort, be in a position to lower your taxes. Are there other ways that we can help individuals with those mindsets to afford healthcare besides taking a chunk of our earning dollars to, and also living a healthier lifestyle, obviously?
I think the federally qualified health centers, which the Better Life Health Center may eventually want to try to become, is a good way, because the fees are based on family size and income. We have federally qualified health centers can take care of undocumented individuals because they don't get into that kind of information. Most of them use 340B, so the significant discounts in the cost of medication. It's a really good safety net provider for communities. And even if the Feel Better Health Center doesn't become one, you may want to have some kind of a connection, because for those people that you are unable to provide services for, they may
And our companies, what we try to do is we have teach-ins where, quite frankly, because navigating the healthcare system is complicated in and of itself. And so even for our firm, we have people within our firm to kind of talk about the differences. What's the tax impact to a health savings plan, pre-tax dollars versus utilizing your post-tax dollars? How do you maximize your health care benefits from that vantage point? So you do have that even in our firm, but in a lot of our companies, they actually do provide those resources to give people an opportunity to ask questions that, quite frankly, are specific to their own family needs.
Mhm.
And the best way for them to navigate and make the best choices in terms of the healthcare. Because something that was mentioned earlier, it is that balance between premium and deduct. What kind of deductible do you have? Balancing that against the kind of premium that you're paying. What's the optimal use for that? How do we
Right.
need, how as a family do you need to think about that level of coverage? Your age factors in. If you're younger, you're looking at healthcare one way. If you're older, you're looking at certainly healthcare and your engagement with healthcare another way. So to one part of that question, Linda, I would say, education is critical. Now, but then you have the group of individuals who don't engage with the healthcare system at all. You still have to reach those individuals because more often than not, that number is increasing. Folks make the decisions not to engage with the healthcare system for a number of reasons. And part of that is, like we were talking about earlier, just natural convenience. When can I take time off to go to the doctor or take my child to the doctor? Do I have trust in the healthcare system? Who can I trust? So part of, the Healthcare Affordable Act, what it really does, it provides the ability to be able to obtain health care. But the one piece of the puzzle that I still think is a work in process and work in progress, if you will, is building the trust factor, building the resources, basically meeting the communities where they are so that they want to engage, so that they can engage. People have done health fairs. We all know how health fairs sometimes can be very effective because, number one, they're free. Doctors are there to at least do some initial testing and initial screenings that may catch an individual who might have high blood pressure on the spot and needs to have that addressed immediately. So, what are the other things that really need to be done in partnership with the Affordable Care Act to make sure that we're not losing people through the system that are simply not engaging for a lot of reasons? I think that's the other part of the conversation that needs to be had.
And Anita, your point is so well taken because I worked for a hospital system that was considered a safety net hospital. So that meant that any individual that had not previously in preventive care mode or using their their insurances had not engaged as a health consumer with the healthcare system, eventually they were going to show up from some emergency. So they were using the emergency room as that healthcare, as that preventive care. They're going to show there. Somewhere those costs are absorbed back into our federal and state dollars. And that means that we as taxpayers are absorbing that time and time again. So it behooves us to have individuals, really go into these federally mandated clinics, supported clinics, or private providers like Prasanna's, Feel Better Health Center. It's critical that they seek it and then work with those providers on how to fund it. Work with individuals and understanding through education. I love that teaching concept, particularly as a workforce retention strategy, so that this big, daunting subject of healthcare is not left to chance. And
I think the key word that Anita uses, navigator. And in the Affordable Care Act, because it was one of my amendments that I did with Kathy Castor from Florida, was to create grants for community health workers, essentially navigators that work within the community to make sure that they get connected to appropriate health care, that they know what's available, they know how to access what's available, and so forth. And one of the things that happened, as you may remember, is that the Republican leadership at the time tried to repeal the Affordable Care Act over 60 times, but
Right.
they were not able to do that, but they were able to not fund programs that were in the Affordable Care Act, like the Community Health Worker Project, like some of the provisions that were meant to increase underrepresented populations in the healthcare workforce at every level. And so if we could just get some of those programs funded that were actually authorized now, that would be a big help. But yeah, we weren't able to get everything done that was passed because funds were removed for one reason or another.
Well, that's that teaching. We just need to have a civic lesson in politics because, first of all, we just need to all of us give you. Let's just all say thank you, Dr. Tana Christensen, because
it was a tri-caucus, really. It was the Hispanic, Asian, and Black caucus working together that tried not only to make sure that the medical care was provided, but that social determinants were also included as a part of the Affordable Care Act, that there were equity provisions that were included.
Yes, and Harsana, I'm sure this is language that you're well familiar with in terms of social determinants, since you're in the community providing these services. What are some of the things that we can walk away from this conversation as advocates? Because that's where it's going to come down to becoming strong healthcare advocates, patient advocates, advocates in our voting habits. You know, myself and Anita and Benita, we're all part of an organization that advocates strongly for African American women and girls in health awareness. And actually, the two of them are part of our leadership and economic empowerment that speaks to this National Coalition of 100 Black Women, Prince George's County chapter. We're a part of that organization specifically to help raise up voices for Black women and girls. Well, Harsana, in your experience, tell us a little bit about these social determinants and what should we be doing to support reducing the incidences of these health tragedies and health conditions that pull on our healthcare system from the start, from your clinical perspective?
So I think everybody has kind of mentioned a little bit about what we need to do. I think primarily trust is a big factor here. How do we get the people to trust us as providers? And how do we, like you said, advocate? We're advocating for their health. Education is huge. If they don't know, then they don't know. But letting them know what it's going to take for them to stay healthy, for them to get the preventive care, for them to go get their mammograms, for them to get their pap smear, for them to get vaccinated and things like that. So education is huge, and it really sends waves through the community, and one person gets that trust, they get the education, they pass it on to others. So it's not just we don't have to just say, oh, only the providers, those who are empowered, hand it over to the community, hand it over to the people, the speakers who have have a voice in the community. And then you're talking about policy change. Policy change is huge.
Absolutely.
If you join a professional organism such as this one, and be a force of change, and getting the speakers of the community involved as well, because that's where you're going to have a lot of you're going to solicit the buy-in from. You start from there, and you kind of move across the community through those leaders in the community. So you have that trickle down effect, but it's a big challenge, and the government doesn't need to do all the work. We could do a lot of the work and make that impact. There are policies that have gone into effect, and there are oppositions here and there, but what can we also do as a community to help those that are on that ground level? preventive care, primary care before they get into the hospitals, preventive readmission. Readmission is huge in the community. It's it eats up a lot of tax dollars, a lot of resources. But if we can kind of take it from an upstream approach, and get the people the care that they need early on, I think that will kind of bring a different perspective to affordability of healthcare.
Are you familiar with any of the health empowerment zones in Maryland?
I see them in passing. I now that I'm a business owner, I'm working towards getting more involved in that. I think as providers, we do a lot of taking care of the patients in our that come through the door, and that's kind of why I left I'm leaving the practice that I'm working with, and then saying, okay, how can I start something where I'm more in the community as opposed to waiting for the people to come to my door, knock on my door, say I'm sick or I'm coming in for a well visit. How do I get out into the community and say, hello, have you had your well visit? Hello, this is important to you. How can I have that presence? And so doing things a little differently than the traditional way of, practicing primary care. So that's, where I getting involved. Yeah.
Those zones were something we couldn't get passed, but Maryland passed them. Anthony Brown when he was lieutenant governor, and Shirley Nathan Pulliam when she was a delegate or a senator. I don't remember which point she got it passed, but one of the impacts that at least one of those had was really reducing the readmission rate.
And I think also supporting the new nurse practitioners and nurses and providers, the physicians, the MAs, and teaching them right from the ground, like right from in school. You kind of have to help the process right from the beginning. How do we work together in making this possible? How do we work together to reduce the inefficiencies in the system, and that's starting from when we're teaching them. And I think if you see like maybe the older generation of how medicine is practiced, that's not the case. But I think a lot of schools are starting to recognize that, and being more involved in the community and getting the students involved from that community level, into incorporating into the programs.
That's really critical, because we know that a lot of our community hospitals have gone by the wayside. They've died. They've just closed up because of the affordable care that is impossible to be able to, create that funding stream that's going to be that safety net in those communities, because you have communities that are underserved disproportionately so. And I think that's what the health empowerment zones aspire to provide the federal grants into those communities to buoy them up, to shore them up if they have been so designated as disproportionately participating in healthcare. So we applaud you, Hersana, because we know that you're on boots on the ground doing that kind of work, and it's difficult. But we applaud you for going out into the community and trying to bring that community needs assessment to life by not waiting for the community to come into the clinic, into the healthcare and seeking services, because by that time there could have been something preventative for something that was much more significant down the road. So we applaud you for that. And Benita, we know that you're retired, but we also know that you're active and involved, and your voice resonates to those who are retired around how difficult it is to afford healthcare. And we, just applaud you for just sharing that information with us, so that it spots a light on what else do we need to do for those who are moving to retirement, who deserve it. You've worked all these years. You don't want to spend your hard-earned retirement funding your healthcare. That should not be where we have our elders and those who are early young retirees such as yourself. And Anita, you're just fantastic, because we know that you're helping these small businesses. And when I say small, probably in the size that I'm talking about, SBA, Small Business Administration, puts them, I have a small business, but I aspire to get to that level of small, the 25 to 50 million, but yet it's all relative because they're picking up a big load in terms of overhead with these premium costs that are skyrocketing. And now it's even more so as we introduce a variety of different health concerns in our society. Pandemic is just one of them. We have BA4 and we have BA5 Omicron variant that is really representing 70% of the cases right now. It's been reported. I looked at those stats yesterday and just blown away at 100,000 cases every single day that's popping up across the country. We're not really seeing that on the news, but it is there. And I just want to wrap up because we have 4 seconds left with Dr. Donna Christensen, who.
Oh wow! I thought we had about 4 minutes.
No, we're at 5. We got. Do we have this? The clock is ticking down, but I wanted to make sure that we just give you your kudos and we can keep on having more conversation because I'm telling you, your has been so formidable.
I'm saying 51.
We got 51. We're at 51. We're leaving at 55. We're signing out of this thing at 55.
Right. But I maybe our guests might want to say
final word.
Before we close.
Benita.
From them.
Yep, just a few seconds.
Yeah, sure. Thanks. Sure, thanks. Just quickly, I agree with you guys in terms of education, and I think oftentimes people overlook to prepare folks for retirement and the impact it will have. So education at all levels is very, very critical. And thanks for having me.
You're very welcome. Thank you for spending time with us. Anita.
Yes, I would echo Benita's comments. Thanks again for having us. I would also want to make sure that as we think about healthcare, we talked about these social determinants, that they also are food deserts. I mean, the food insecurity is a huge social determinant of health. Safety is a social determinant of health. All of these things, it's going to take a village to continue the work that Dr. Christensen did in Congress, and I'm sure continues to do outside of that venue. But a lot of work to be done to heal our communities and provide equity, health equity across the board. So thank you guys for the topic, and thanks for having us appear on your show.
I just want to underscore too what Hassana was talking about in terms of policy. Of course, as a retired politician, it is so important to join those organizations and to be strong advocates for the things that need to change. Our Consumers for Quality Care did a lot of work around surprise billing, and we got a bill passed to end surprise billing. Now we still have to take a look at that and follow it to make sure it's implemented properly, so that we really end surprise billing. But there's there are a lot of issues that need to be addressed. I know the White House has tried to take some action that they could, reducing the cost of insulin, for example. That's one. Taking medical debt off of the credit ratings, so because that has had a very adverse impact on families. But there's a lot of advocacy, and it all begins at the ballot box, guys. Voting is going on now. Voting is coming up in November. Make sure that we advocate for people who, whatever party, but who advocate for the issues and who support the issues that are important to our health.
We believe in that. We believe in strong advocacy. We believe in education, and we believe in addressing the social determinants and really being out in the community. And all of your voices have been fantastic today, and we certainly applaud them. And we thank you for joining us on the Health, Wellness, and Lifestyle program on this Wednesday with Linda Dorman and Dr. Donna Christensen here on OurTV.network. We're going to wish each and every one of you a great rest of the summer. And, we're going to get to the ballots. We are going to vote, and we're going to continue to advocate. And
bring other people to the ballots as well.
Bring other people to the
There's so much at stake. There's so much at stake for our community that we really need to double our efforts.
And there you have the final word. Double your efforts at the ballot. So have a great afternoon, everyone. And thank you.
Thank you very much.
Thank you.
I used to watch BET, MTV, VH1, now I watch Tempo. Soca, Calypso, Reggae Dancehall. Don't stall, better get tuned in to the tempo. Don't have cable, they got an app. Go to your app store, download that. Whether it's tourism, cuisine, or the social scenes, if it ain't Tempo, it's a rap. Who got the Caribbean views? Tempo. It's the latest in Caribbean news. Tempo. You tryna cook Caribbean food? Tempo. You know they got the music videos too. Tempo. Who got the Caribbean views? Tempo. It's the latest in Caribbean news. Tempo. You tryna cook Caribbean food? Tempo. You know they got the music videos too. Tempo.